Hello everyone, I am Dr. Pratyush Kumar and this video is all about family medicine. What's the future holds for the young PG graduates of family medicine in India? What's the status of family medicine globally? So these are some of the important points which I'll be covering in this video series of family medicine. So before I start, let me introduce myself. I am Dr. Pratyush Kumar and I have done DNB family medicine from Sir Ganga Ram Hospital, Delhi. So job prospects in medical colleges, their Department of Family Medicine and Geriatrics are there. In corporate hospitals, you can just become from registrar to consultants. Government jobs, CSC district hospitals, telemedicine, private practice, global opportunities are there. So when I took family medicine during 2013, the job scenario was not very favorable for family medicine postgraduates. But now, after this Indian Public Health Standards 2022 has come into the place, job scenario has completely changed. Now, in the coming years, there will be much more and more jobs will coming up because the government has started focusing on family medicine. Earlier, we had only had DNB programs, but now they have also started diploma in family medicine in district hospitals. So obviously, to teach them, we need more family doctors. During the undergraduate curriculum, as I told you before, during the foundation years, then in 2017, we had National Health Policy 2017, and there was clear recommendation to popularize MD, Doctor of Medicine course in family medicine or general practice. So it was very important that this singularly they named to popularize family medicine, and it was a policy decision of Government of India. Then came India 3 years action agenda 2017-18 to 1920. And in that, also human resource for health, they clearly mentioned that we must create a cadre of primary healthcare practitioners by introducing a 3 years competency-based dynamic course for primary, community, and family medicine. Then we saw internationally the fourth Global Forum for Human Resource for Health. They call for prioritizing workforce developments of primary care functions. This must include development of the family medicine workforce, ensuring a strong medical workforce at the first point of medical contact, and deliver a well-trained and supported workforce for rural as well as urban settings. So this was in 2017 that happened. They also emphasized the fundamental importance of a competent, enabled, and optimally organized and distributed health and social workforce, especially in rural and underserved areas. So they understood the role of family medicine in strengthening primary healthcare, especially in rural areas. Then later on, we saw in 2019 there was a report. It was high level group on health sector, and they made some clear recommendation to recognize its need of family medicine specialty, to create a suitable ecosystem for family medicine specialists, because this is very important. Because what has happened all over India, because family medicine was there in place from 1983, but still family medicine wasn't as popular. With the number of family medicine postgraduates were not that much. The region was that post family medicine PG, they were not suitable ecosystem. Like there was not such job opportunities in private sector and also in the government sectors. So it was difficult for people to take family medicine as a career choice if we didn't create a proper ecosystem. So that was the problem by then. And they realized that there is a problem why family medicine is not getting that much popularity, because we haven't created that ecosystem. They realized, and in this report, they have clearly mentioned that they want to create a suitable ecosystem for family medicine specialists, family medicine department in all medical colleges and programs at district level, model centers at aims, and create opportunities after pursuing family medicine. NMC Act came in 2019, and they have clearly mentioned to promote and facilitate postgraduate courses in family medicine. So this was a very important decision taken by the new NMC, which replaced the old MCI. And this act came in 2019. Principle of family practice was incorporated in the orientation module of the foundation years in the undergraduate medical education program. So as I told you before, they realized that unless and until the undergraduates, MBBS students aren't aware about family medicine, they aren't exposed to family medicine, then how can they develop the likings, the urged to take family medicine as the PG career choice, because everyone makes their choices, or they develop the liking for any specialty only during undergraduate curriculum. When they decide to take that, look, I'll take ophthalmology, I'll take pediatrics, only during undergraduate curriculum, especially during the internship, they know that what they want to become in future. So unless we don't expose them during the undergraduate curriculum, it will be very difficult for them to take family medicine as a career choice. So National Board of Examination in 2020, they established a specialist board in DNB family medicine, and in 2021 they came up with the PG curriculum in DNB family medicine. It was revised PG curriculum, Indian Public Health Standards 2022. Because till now what had happened, no, that family medicine jobs were not there in the primary, secondary, or tertiary health sector. It's only because the Indian public health standards didn't recognize family medicine in their list of competencies. So now on, after 2022, whenever the state governments will take out uh, notices for recruitment of doctors at CSC and UCSC, there will always be a place for family medicine specialists, because now they have the IPHS 2022 in place, and that has given a provision of family medicine specialist at CSC and UCSC. As the number of family medicine physicians in the system increases, it is strongly recommended that they should be deployed in the public health system. This inclusion can be in a phased manner, with posts being first sanctioned at CSC level in the short to medium term, but at the same time looking at the offering post in the primary care settings in the long term. So long term is to give them post at the primary care level also, but now because family medicine postgraduate, the PG trained where doctors will still be less, because there are only few places, not much places, where we see the training happening in family medicine as a DNB, MD, or diploma course. So now they have started diploma courses also. But in the near future, we'll see lots and lots of family medicine specialists taking these jobs. So the big question was to create the family medicine ecosystem, and this is the important way how they are creating the family medicine ecosystem to secure the future of family medicine specialists. So 2022 Union Health Ministry, they intended to launch MD family medicine program in aims like institutions in Raipur, Rishikesh, Jodhpur, Patna, Bhubaneswar, Jodhpur. They are all there. There have been some other developments, like they have started AFPI has started with Medversity Fellowship in Family Medicine program. It's a 1 year program. Then again, the AFPI Karnataka chapter has started a fellowship program with St. John's Medical College. Indian Medical Association Academy of Medical Sciences have also started a fellowship in family medicine program. These are 1 year fellowship programs.